Good evening, Big Spring. I'm Dr. Roberts, Superintendent of Schools. Now that we're about a month into the school year, I wanted to provide an update with several pieces of information as they relate to the start of the school year. So first, I'd like to talk a little bit about COVID data, where we stand as a county, in the zip code, and also as a district. Then I'd like to share with you some guidelines that have been provided to us from the Pennsylvania Department of Health for when we would look to move to a suspension of in-person learning and move to a remote learning platform. After that, I'd like to share with you a resource that is new to the district this year so that you're able to see information that we have regarding COVID data, COVID cases, the number of individuals who are symptomatic or have been exposed as a close contact to a positive COVID case. And with that, I'll share some of those data points as they relate to our buildings. Next, we'll talk about what it would mean if we did have to move to a suspension of in-person learning and move to remote learning for one or more of our school buildings. And lastly, while it may seem early with the turn of the calendar, I think it's important to discuss what we would do in the event of a weather-related closure. So moving forward, we'll talk a little bit about the levels of transmission of COVID as they relate to the CDC's levels of transmission. And CDC outlines 4 levels of transmission, as you see from the screen here. They start with low, move to moderate, then to substantial, and on to high spread. And determination of which level a county sits in are based on one of 2 key metrics. The first being incidence rate, and that number is based upon the number of incidences that exist within a county per 100,000 residents, and the second being the percent positivity. So the number of individuals that are tested, what percentage of those individuals actually test positive for COVID. In the low range, which is where we were over the summer months, the incidence rate would be less than 10 cases per 100,000. In the moderate range, that would be between 10 and less than 50 cases per 100,000. Substantial, it would be 50 to less than 100. And high spread or high transmission for incidence rate would be more than 100 cases per 100,000 residents. From percent positivity, from that perspective, for the low range, it would be less than 5%. Moderate would be between 5% and less than 8%. The substantial range would be between 8 and 10%, and anything above 10%, 10% or greater, would be high spread. It's important to know that should a county reach any one of those thresholds in either area, it moves them into that level of transmission. So for Cumberland County, we're currently in the high spread range for the incidence rate, but just below that in the substantial spread for the percent positivity. So it's important to know that any one indicator can move you into one of those levels of transmission. So moving forward, talking specifically about Cumberland County and our data, this first slide talks about the incidence rate. Currently, our incidence rate within Cumberland County is at 327.98. That is, of course, in the high range for transmission and is comparable to where we were last year at the tail end of November or beginning of December. Down below, I listed several reference points just for points of comparison. And you can see that in August of this year, mid-August, we were at 97.49 per 100,000 residents. Later than that, about 3 weeks later, when I provided an update to our board of school directors, we were at 198.52. So you can see a steady climb in that incidence rate over time from a mid-August update all the way through today, sitting at 327.98. Looking back at last year, and you'll hear me reference a comparison between last school year and this school year throughout this update. Looking back at last year before the start of the school year, we were at 29 cases per 100,000 from an incidence rate perspective. So dramatically different this year than it was last year. As we move forward, we'll look at the percent positivity. Again, out of the tests that are administered to determine if an individual has COVID or is positive for COVID, it would be the percentage of individuals tested that are indeed positive. So currently we're at 9.03% as a county. And as a comparison, again, if we were to look back over the course of the last year, where we were at that rate before, that would be just about at the same point. Late November, early December of last school year is about where we were at that same percentage. In mid-August, we were sitting at approximately 6.99%, so a few percentage points lower. About 3 weeks ago, we were a bit higher, and we're seeing that fluctuation, as is the case with all tracking of data over time. We're seeing the fluctuation up and down, so a move in a positive direction from 10.92 to 9.03. And lastly, looking back at last year before the start of the school year, we were at 4%. So once again, dramatically different this year than it was last school year. As we drill down even further and look at zip code data, there are 3 zip code regions, if you will, that I brought forward that make up the large percentage of our geographical area within the Big Spring School District. And the first being 17241, or the Newville zip code. And our positivity rate for the Newville zip code right now is at 50%. So in other words, every other individual that's tested in our zip code is testing positive. The incidence rate is currently at 351.9. Moving to the east a bit, a percentage of our population does come from the Carlisle zip code of 17015. They're about half of what the positivity rate is within the Newville zip code at 25.3, and an incidence rate of 194.14. Finally, a section of our district does come from the Shippensburg zip code, and that percent positivity is 41.26, and the incidence rate is just over 200 at 200.7. So it's important as we drill down to be able to look at local metrics as well to determine if what we're seeing at the county level is what we're seeing within our school district. And quite frankly, our school district transmission numbers are a bit higher than they are as a county in general. So moving forward and continuing down the theme of a comparison between 2 school years, the Pennsylvania Department of Health shared a comparison of last school year to this school year with one specific week recently, and that week was September 8th through the 14th of last year to this year, and looked at the number of COVID cases for school-age children, so those children between the ages of 5 and 18. So last year, September 8th to the 14th of 2020, the state saw 630 positive cases within those age groups. This year, the same week, the state saw 7,218 cases. So we're certainly seeing that our younger population, our school-age children, are more impacted right now by the virus than they were last school year. As a district, we're seeing a similar trend. So as we process cases through the district level, we're looking at 3 primary groups. We're looking at students or staff that are either indeed a positive case, a confirmed positive case. We're looking at those that are symptomatic or demonstrating symptoms that are indicative of COVID. Or we're looking at those individuals that are identified to be close contacts as a result of our contact tracing. Last school year through October 1st, we had 63 of those cases. Again, positive individuals, symptomatic individuals, and close contacts. This year, that number has grown to 326 in the same time frame. So once again, it really is a tale of 2 school years, and that we're seeing the transmission rate with our younger individuals, our school-age children primarily, it's transmitting at a higher rate than it was last school year. When looking at making decisions to move to a remote learning environment from an outbreak containment standpoint, the Pennsylvania Department of Health has shared with all school districts guidelines for making that decision. Essentially, each school district looks at a 14-day rolling window and tracks the cases that I had just mentioned before, those positive cases. That the Pennsylvania Department of Health put forward that once a school has reached 5% of the students and staff that attend that building being identified as a positive case, that's where we would be in close collaboration with the Department of Health regarding a potential suspension of in-person learning. For the threshold of small schools, so schools that have less than 500 students and staff combined, that is where our elementary buildings would be. And based on enrollment, you can see from the screen the number of positive cases that we would look at to engage in that conversation with the Department of Health. So for Mount Rock Elementary, when there would be 17 positive cases within a 14-day rolling window, we would be having that conversation with the Department of Health as to whether or not we suspend in-person learning and move to remote learning for some period of time. At Newville Elementary, again, based on enrollment, that would be 18 cases, and at Oak Flat Elementary, that would be 19 cases. For medium-sized schools, moving between 500 and 900 students and staff combined, that encompasses both our middle school and our high school. So at the middle school, based on enrollment, we would be looking at approximately 30 cases, and at the high school, we would be looking at approximately 40 cases. So once again, those thresholds are critical in that once we reach that number of positive cases, students and staff combined, that's where we're engaging with the Pennsylvania Department of Health, talking about whether or not we would need to suspend in-person learning to contain any outbreak. So to find our updated data regarding our positive cases, you can access that on our district website. From the screenshot you see here, I'm showing exactly where you would locate that. So once at the district website, under the 2021-2022 key information, there's a sub-tab titled Current Case Totals. When you click on that sub-tab, you'll see the screen that is shown here, outlining essentially a dashboard of those cases. So again, in the center of that screen, you see not only the student enrollment by building, but then you see a section called active cases, and those would be positive cases that existed within a 14-day rolling window, that 14-day rolling window. And to the right of that, two other columns are shown. Symptomatic individuals, so any individuals that have demonstrated any symptoms that are indicative of COVID, or close contacts. Again, those are the individuals that met the criteria of being identified as a close contact to a positive case. So these totals, this dashboard, is updated on Wednesdays and on Fridays. So while it's not live in terms of having information as it comes into the district, it is updated frequently so that you're able to see trends within all of our buildings. So currently, and I'll outline more the positive cases, but you can see on the dashboard the other two columns. But currently, the high school has the highest number of cases. We're at about 2.5% of our enrollment population there with 20 cases. That came through two days, had a higher total of days coming in where we had positive cases come through. So over the next week, about 13 of those cases will come off of the 14-day rolling window. But nonetheless, that is a building that we're keeping a very close eye on and are in close collaboration with the Department of Health. Our other buildings, while one case is way too many, our other buildings are showing a much healthier status in terms of the number of positive cases in the building. The middle school currently has 6 cases with 4 students and 2 staff members. Mount Rock Elementary has 3. Newville currently has 0. And looking down at Oak Flat, it's 3 cases for students and 1 for staff members. So again, we're watching all of those numbers very closely, all of our buildings very closely. And should we move closer to that 5% threshold, that's where we would be in close contact with the Department of Health regarding a suspension of in-person learning. So what would that mean? If we did have to suspend in-person learning, what would that look like? So last year, as you may recall, and bringing it into this year through our Staying Open plan, the district has defined 3 tiers of learning. There's Tier 1, which is fully remote learning. Tier 2, which we experienced some last year. It's a hybrid model with 2 days of in-person learning and 3 days of remote learning. And lastly, there's Tier 3, which is fully in-person learning. It's the learning environment that we're experiencing right now. So if the district had to suspend in-person learning, that suspension would be a movement from Tier 3 to Tier 1. And let me stress, our goal would be looking at this information building by building. If we could localize the need to move to remote learning from in-person to one building, only that building would move to remote learning. The other buildings would continue to be in-person learning if we weren't seeing the same trend with an increase in cases at those buildings. So again, that shift or suspension of in-person learning would mean a shift to Tier 1 learning, which is fully remote. Schedules for what that would look like for Tier 1 learning by building will be posted to our website in the coming days so that you're able to see what that could look like should we need to move in that direction. In terms of the duration or how long we would be in Tier 1 or fully remote learning if we did need to suspend in-person learning, that could be any period of time from 3 days to 14 days or potentially more if the outbreak was such that we had to contain it by extending the length of time that we were in remote learning. But typically between 3 and 14 days. And again, that determination is made in close collaboration with the Pennsylvania Department of Health. Last school year, as I mentioned before, we utilized Tier 2 learning, which was hybrid learning. We don't intend to use Tier 2 unless we're noticing a situation where we need to suspend in-person learning and we move to fully remote learning. And once that period of time is done and we move back to fully in-person learning, we're seeing an outbreak continue yet again. We would move to Tier 2 as layering another safety prevention strategy, and that would enable us to cohort students and reduce the number of individuals in our building. Again, we're not at all at the point of considering Tier 2 hybrid learning right now, but it's something we have at our disposal should we need to move in that direction. Moving forward, and again, while early October, I do want to be able to provide you with some information so that you're able to plan as a family for weather-related closures. Two of those snuck up on us early with Hurricane Ida. Within the first week of school, mind you, we had those 2 days that we did have to cancel school, one due to flooding and the other due to power outages. Those makeup days are February 21st and April 14th. April 14th is the Thursday before Easter. We do have 2 remaining makeup days built into our school calendar. Those days are April 18th, which would be the Monday after Easter, and June 10th. So in 2020, our district submitted to the Department of Education for approval of 5 flexible instructional days. Those days provide for an alternate approach to delivering instruction if a school is not able to do so face-to-face. Most of the time, those days are utilized for weather closures, and that would be remote learning. So moving forward, if we have a weather-related closure in the coming weeks, months, we'll be utilizing those 5 flexible instructional days, those remote learning days, to address those makeup days, and they would happen on the day of the closure. So again, we'll utilize those flexible instructional days if we have weather-related closures in the near future. If we do need to use those 2 days that are built into the calendar, you'll receive additional communication from me on the day of the closure. But in planning as a family, please know that if we do have a weather-related closure, we'll utilize the flexible instructional days, and that schedule will be communicated to you in the coming weeks. As I close Big Spring, I want to thank you. I want to thank you for your partnership and your support. The ultimate goal in us working together through this partnership is to make sure that our students can be in school 5 days a week in person and enjoy those experiences that they love so much, whether they be extracurricular experiences or just enjoying time with the teachers and their friends that they enjoy being around. So as we partner, some of the decisions that we make may not be entirely popular, but every one of those are pointed at the goal of keeping our students in school and keeping them safe. I ask you, as we move into the heart of the school year, please continue to monitor your student for any symptoms and keep them at home if they show any symptoms. It's important for us to be able to keep our arms around this virus and make sure that we are pushing back and not allowing for the spread of the virus. And the best way to do that is to monitor the symptoms. And if a student has any symptoms that are indicative of COVID, please keep them home. Lastly, please stay in close communication. If you need any information or have any questions, whether it be about programming or the pandemic, we're here for you. We stand ready to answer any questions that you may have. The next few weeks and months, Big Spring, may prove to be challenging for us. The pathway of the virus is uncertain, but I can tell you without a shade of a doubt, I am certain that Big Spring's best days are ahead. Please continue to keep your heads up, stay strong in partnership, and always stay ever always strong. Have a great weekend, Big Spring.